Hi there, everyone, and thank you very much for joining us for tonight's webinar, particularly given the lovely weather outside that I'm enjoying where I am anyway. It's much appreciated that you've come along to join us. We're very happy to have Colin Mason speaking to us tonight. As most of you will know, Colin is Centre Manager of our Dumfries Disease Surveillance Centre, so he's right in the thick of the dairy side of things down there. And he's going to talk to us tonight about dairy beef systems and how we as vets can really help people make the best of them. So without any further ado, I'll hand over to Colin. I should say before I do that actually that any questions are always welcome, as you know if you've been to these webinars before. You'll see in the panel that you have that there are tabs. There's a questions tab and a chat tab. Please put any questions that you have in one of those panes. We'll keep an eye out for them throughout the webinar, and there'll be time at the end for Colin to address those. So any problems at all, you can also raise your hand. I'll try and keep an eye out for you and help out anyone that's having difficulties. All right, so I'll pass over to Colin and let you get started.
Thanks very much, Ailey, and good evening, everybody. Thanks for coming along this evening, and thanks for your interest in this. What I want to talk about a little bit is the sort of evolution of integrated dairy beef systems and what that means for us as vets, and what it means is now, and probably what it's going to mean in the future as well, how the systems might develop and how we might be able to steer some of that as well. So I've got a range of things to talk about, and along the way what I want to do is mention some of the key health issues and some of the key diseases, some of the new diseases and new and emerging diseases we're seeing that perhaps go along with this system. So again, thanks for listening. What I want to do is cover industry issues, some of the challenges, common disease findings, and how to diagnose and manage them and get a foot in the door, and some of the options for the future. So maybe just a bit of background. Winding the clock back a couple of years ago now, there was a real drive from the UK cattle industry as a whole to address the issue of the use of dairy calves, and particularly surplus male calves born into the dairy herd. And what they came up with was this GB dairy calf strategy, sort of 2020 to 2023. So we're slap bang in the middle of that now. And that's increasingly becoming embedded in individual milk contracts, first of all, and also further into farm assurance. So, you know, for example, perhaps Arla have been one of the big leaders of it in terms of their milk contracts for dairy producers, but most of the milk contracts now have a big section on carbs, use of carbs, etc., and red track to do going forward. And the background to this is these key points here: rearing all calves with care, and ending the euthanasia of bull calves, which is a particularly difficult issue for consumers, and that's pretty much done. Big moves in that direction, which has been a real plus for the industry. These standards are incorporated into red tractor standards going forward, and the aim is to finish dairy cross calves as either finished beef or possibly in a narrower market for rosé veal. Clearly, as part of this, a viable calf and animal welfare is really, really crucial. And one of the calls from the calf rearing companies and the calf rearers, which is certainly now increasingly being heeded, is to produce a calf that is likely to have some value in terms of the beef cross calf. And some of the challenges that we know about will be the smaller calves, smaller heifer calves, potentially beef cross heifers, and calves born to New Zealand cross dairy animals or jerseys, where the calf will be a smaller frame, and it's how to make best use of those animals and how to change the breeding strategies from these sorts of dairy cows going forward to make them work better. So some of the things that are built into the farm assurance standards really going forward from now, the red tractor farm assurance standards, is dairy farmers must have a written breeding policy in terms of how they're going to manage dairy bull calves, what they're going to breed and how they're going to do that going forward. Thinking about semen use and breeding strategies, we'll talk about that very briefly in a minute. As part of Red Tractor Farm Assurance Standards as well is a collation of calf births and deaths and calf mortality rates as part of their annual health review. And clearly, to maximise the use of beef cross breeding in the dairy industry to increase the value of dairy calves. So whether that is British Blues and Aberdeen Anguses, or whether that is Wagyus or Longhorns, these have been some of the interesting developments that have come forward with niche markets to try and supply what the consumer wants ultimately. So steps forward that have been made there. There have been real step changes in breeding policy as a result of this, and a lot of dairy farmers have really embraced this, and these figures really show this. This is just up to the end of 2020, and they show the various proportions of semen sales and semen use. These figures are collated by AHDB, and you can see in the graph on the right that the use of sex semen has jumped massively in response to these challenges that have been laid down in the industry. So over half of the dairy semen sales now are sexed, so that brings this whole initiative forward, and the proportion of beef inseminations now in terms of overall semen sales is increasing dramatically as well. So a much more widespread use of beef semen within the dairy herd, and these changes are feeding into a lot of the dairy farms now in terms of how they go. And for us as vets and for farmers as well, it does bring some challenges and some opportunities, and I've tried to highlight a few of these here. One of the ones, I guess, is perhaps a perceived issue with conception rates with sex semen, something that I think is increasingly much less of an issue, and the sex semen that's available now has much better conception rates, really for good bulls, equivalent conception rates to conventional semen. One of the challenges that some of the vets have raised is around calf viability and value, and if you have a small runty calf, is no life better than a poor life? And that's an interesting ethical question to juggle with, and clearly getting the breeding right, calf value and breeding, and meeting the needs of the whole supply chain is crucial in that. There's always a challenge with any of these systems is that there will always be really good strong calves and weaker calves, and what happens to those poorer calves, and is there a market for those? And some of the challenges that we have seen on farms, on dairy farms, which I think a lot of dairy farmers are now rising to, is if you're rearing beef cross animals as well as dairy heifers, that there's an increased stocking rate for calves, perhaps more calves on the ground on the dairy farm for certain periods of time, which might challenge some of the health issues on those dairy farms. If you've got more calves on, stocking rate goes up, there's more of a challenge, which might be exacerbated in TB areas. Again, some of the other challenges might be around seasonal calving herds, New Zealand type herds, where all the calves are coming in a short space of time. And then obviously some of the challenges with the whole integrated supply chain system will be around the use of collection centres, the biosecurity around collection centres, and the mixing and stress of animals through those collection centres. So they're all great challenges for us as vets. You could possibly argue if the pig and poultry sectors took a look at some of these supply chains, they might not like the way that we're doing it with the dairy supply chain, but the systems are evolving quite nicely, and although they have challenges, they can be overcome to some degree. Clearly, there's opportunities with these systems as well, in that if we can rise to the challenge of improving calf health overall, there's wins for the dairy herd, there's wins for the dairy heifers, and there's wins for the integrated supply chain beef animals as well. The use of sex semen, it brings advantages in terms of greater advances in genetic potential of the herd, using sex semen on the best animals, and perhaps using genomics as part of that to really increase the genetic potential of the dairy herd. There's also opportunities for some of the endemic disease control there as well, in terms of selectively breeding Johne's positive animals to beef, Neospora positive animals to beef, and managing certain diseases through the use of sex semen presents a real opportunity as well. And as I say, the opportunity really to improve calf health overall. And that's one of the key messages. A lot of what I'm going to say in this talk is applicable to dairy heifer calf health as it is to dairy beef calf health. So obviously, some of the challenges with this, baby calves, when they're born, as we all know, are vulnerable. At birth, they are gamma globulin anemic. they have a poorly developed cell-mediated immunity, and they have high levels of high levels of cortisol swashing around. So they're stressed when they're born, inevitably, and they have a poorly developed and needing to be stimulated immune system. Other challenges with the system as well is that when we're selling animals off a dairy farm or moving animals off a dairy farm, we don't know their disease status. We don't know what they're carrying with them necessarily at the moment, and we don't necessarily know their immune status. And by moving them off their source farm onto a new rearer farm, then we're also stressing them. So there's some clear challenges with the system. And then there's some of the facts and figures of what the disease challenges are for dairy-bred, artificially reared calves. And there's some data in this slide from different studies, one from 2009 that showed that up to 12% of calves were lost in the first month of life. Another more up-to-date study in 2017 showed that the average calf mortality in the first 2 months was 4.5%, with a range between 2 and just over 8%. So those are real figures from real dairy farms, and we do have challenges with calf health and calf mortality on our dairy units, as we all know. Other studies have shown that roughly half of calves, if they're scored, will have either an episode of diarrhea or an episode of pneumonia in the pre-weaning period. So again, we have disease challenges that we need to overcome in these systems, and those are the facts. So what are we seeing in Scotland's dairy farms? What are the main things that we're seeing? And I'm going to acknowledge and show some of the data that my colleague Katrina pulled together from work that we've done at SRUC, and just in terms of our surveillance submissions through the labs. And what Katrina did was basically review all of our diagnostic submissions and results from pre-weaned dairy calves. So she looked at a set of pre-weaned dairy calves that we'd examined over a 4-year period, which was just over 600 dairy calves in that pre-weaning period. We had a good diagnostic rate, 98% diagnostic rate, and from those 614 calves, we made just over 1,000 diagnoses of things that were wrong with them. So we accept it's a biased data set, and that these are calves that people are bringing in for post-mortem, but at the same time, it's a relatively decent sized one, and it can give us some pointers as to what we're seeing as causes of mortality, at least in Scottish dairy calves. And I'm going to come back to this survey a few times throughout the talk and pick out certain areas of it, but these were the top 10 diagnoses that we had, and a lot of the things on there would be no surprise, in that you've got key causes of diarrhea, you've got key causes of pneumonia, plus cholesepticemia and navel ill. So no great surprises there. Perhaps the only bigger surprise with all of this would be some of the nutritional issues which came to the fore, and we'll talk about that a little bit more later on as well. So that's what we were seeing in Scottish dairy calves submitted through the SRUC labs, in terms of the ones that died, and it gives us a reasonable snapshot of the common things that we would expect to see. And obviously at a root of all of that, and this is one of the key things around the whole integrated dairy supply chain, will be the issues around about failure of passive transfer and colostrum management. And nothing is new here. A lot of the things with calf disease are not new, and this is one of the key challenges, not only in terms of getting it right, but trying to be sure that calves that are moved off the dairy farm have a consistently good supply of colostrum and a good colostral immunity. So some of the facts and figures, UK studies, depends on which study that you look at, but somewhere between 14 and 26% of calves experience failure of passive transfer. And another indicator is that roughly 40%, possibly more in some scenarios, of calf mortality in the pre-weaning period is associated with failure of passive transfer. So really big issue at the start. The cutoffs that we use to measure it are general, and calves are individuals, and we'll come on to measuring FPT in a minute. And the levels of colostrum that are required will depend to some degree on the calf and the disease challenge that it faces. And the ability of that calf to absorb immunoglobulins will also be an individual thing for that calf as well, and will depend quite a lot on that calf's entry into the world, its calving ease, calving duration, and calf figure, which will all influence how well it absorbs its immunoglobulin. So numerous factors will affect the risk of failure of passive transfer, and we'll pick out a few of those in the next couple of slides just to go over a few of these issues. And these are, I would say, really important parts of the workup that a lot of vets will be doing on dairy farms, and a big feature of how we manage health and disease through the integrated supply chain. So firstly, quantifying failure of passive transfer and colostrum quality. It's easy done, and it's well defined, and just going over some of these ones again, assessing it from the calf point of view, that the definition of successful passive transfer is that we get 10 grams per litre of immunoglobulin in calf blood. And if we exceed that, then we've done our job pretty well. And we don't measure that specifically, but we have good proxies for this, and probably two of the best, or certainly two of the most readily used, would be a serum total protein of more than 52 grams per litre, or a ZST with a cutoff of around about 15 units. Some studies would say slightly lower than that at 12, but 15 units as a cutoff for the ZST test. And if we're above that, then we're doing okay. So reasonably sound measures. The cutoffs that are there, obviously they can be moved, but they're there to optimize the specificity of the test. So we're hoping to basically reduce the number of calves that we would falsely classify as having achieved a good colostral status. We're trying to be as specific about that as possible. And here's a debate point, but one of the suggestions that I've come across is that it, if a dairy unit is doing well, then more than 85% of calves should be achieving adequate colostrum status and be above these thresholds if they're measured. So that's something that could probably be debated and might be farm specific in terms of how they're achieving it, but it's an interesting target to sort of put down as a marker. Similarly, if we're assessing colostrum quality and looking at the colostrum that's available to dairy calves, then good quality colostrum, we want it to be greater than 50 grams per litre of IgG, and a good proxy for that would be using a Brix refractometer with a 21% cutoff there. So those are some of the measures that we can use and can make. And once we've got those assessments, if we're trying to think about successes and failures of this or how to optimize this, I'm not going to go through all the aspects of colostrum management and how to influence it. We haven't got time to do that, and a lot of them are very well known, but I wanted to pick out a few of the points that are maybe grabbing a bit more interest at the moment and might raise a few debates. Was at a meeting a few weeks ago on welfare, and it was interesting in that some of the people were suggesting from a consumer angle that routine stomach tubing of calves perhaps should be raised as a welfare concern. Is it right for us to stomach tube every calf as soon as it's born? And that sparks a whole interesting debate about what is right or wrong for these calves. And I think, speaking as a vet, we very much need to balance the risks of that technique, or some of the perceived issues with that technique, with the genuine advantages of doing that in terms of the long-term immune status of that calf and the long-term health of that calf. So that's an interesting debate for a start. And it leads you to the suggestion of, well, where is the risk of failure of passive transfer depending on administrative route? And there's some figures in the slide there, but certainly what we know is if we leave calves to suckle the dam, then the risk of failure of passive transfer is going to be much higher than it is if they're stomach tubed, and there doesn't really seem to be much of an advantage of bottle feeding a calf over stomach tubing a calf in terms of whether it absorbs your immunoglobulin or not. If they're going to suckle the dam, it needs to suckle for a long time, and it's unpredictable depending on all the variables of the cow and the calf. And there isn't a massive difference between stomach tubing and bottle feeding. Partly there might be the reckoning that there will be a slower absorption of immunoglobulin, slightly slower if they're stomach tubed, just because some of that colostrum will end up in the rumen to start with and ultimately flow down into the abomasum from where it will be absorbed. So a few interesting thoughts and debates around administration route. a few interesting thoughts around volume as well, and then how much do we give in that. I think the core message that has got out really successfully to a lot of farmers is if we feed 10% of the body weight in colostrum in the first 4 to 6 hours of life, then that raises the chance and raises the opportunity to give that calf maximal colostral immunity. And that's been a really successful message that has really helped the game along in the last 5 years. Some people, again, have questioned that in terms of giving a really large volume of colostrum by stomach tube in very early life. Does that affect abomasal function in any way? Does it increase the risk of abomasal problems, abomasal bloats, that sort of thing? And that is certainly a question that has been raised. And I think my take on it is you know, we need to carefully assess calf weight. You know, is it a 40 kilo calf? Is it a 35 kilo calf? You know, and assess that in terms of the volume that we feed. And we also have to think about, you know, how well are we snatching carbs, and has that calf taken any of its colostrum off its mother before we get to it, and what's in its abomasum already. And, you know, perhaps a slightly lower volume in the first 2 hours, and then 3 litres, and then another 3 litres within 6 to 12 hours, if it was manageable, might be a good compromise. But it all comes down to the best systems and protocols that can be put in place on a farm, what works well, and certainly coming back and reviewing that from time to time is a good thing to do. The other one is around colostrum cleanliness, and what we know is that if colostrum is dirty in any way, then that increases the risk of spoilage, first of all, and it basically reduces the opportunities for IgG absorption in dirtier colostrum. And that's been studied by a range of studies. There's a recent Scottish one that will shortly be published as well. But there are quite clear recommendations of what the total bacterial count and the total coliform count should be in colostrum, and where we should be, and that's measurable and can be something that can be done in terms of looking at, you know, not just colostrum quality in terms of immunoglobulin that's there, but its hygienic quality and the effect that that can have on absorption of immunoglobulin, which can be quite dramatic. So there's some things that can be done there. And that leads on to a debate about, do you pasteurize colostrum or do you not? And is that going to help? And certainly it's been cited and highlighted as a useful tool to help with control of Johne's disease, to control with Mycoplasma bovis and with Salmonella Dublin. It does need careful monitoring. It will reduce bacterial load, but it won't sterilize it. And we need good quality colostrum if we're going to pasteurize it, because you will reduce the IgG content a little bit. And really, one guide would be only to pasteurize if you're more than 60 grams per litre in terms of its quality at the start, to ensure that we end up with good quality colostrum that's then been pasteurized. So some of the things to think about, I'm a fan of pasteurization. I think there's a lot to be gained from it as long as it's done well and we've got good colostrum quality at the start. So I wanted to spend a bit of time, as I said, on failure of passive transfer, because it just is not new. It's often needing to be considered and is being considered on dairy farms, and it underlies so many of the health issues that then follow. I want to move on back to Katrina's survey and just focus on some of these nutritional issues that definitely affect calves in terms of digestive upsets, and can be either a sole cause of mortality or can also be a predisposer to a severe illness or mortality. And it's something that we see in dairy heifers, and it's something that we see in the dairy beef systems as well. And interestingly enough, in the survey that Katrina did, 26% of the calves had a nutritional component that was significant in their death, which I think is a really interesting finding, and is something that's probably not been highlighted that much before. We focus so much on infectious disease, and this is something completely different. And the different things that were being seen, rumen drinking, acidosis, rumenitis is definitely one of the issues. And we do see some of them with fungal rumenitis. The other one is Albumasitis, ulceration, and bloat as well. And if we're going to group the two things together, it would be the abomasal issues and the rumen issues as perhaps two separate groups, although I think they're ultimately linked in different ways as well. Albumasal bloats is maybe something just to mention for a minute or two. It's certainly something that can be a clinical problem as well as a cause of mortality in milk-fed dairy calves, and presenting clinically with a predominantly right-sided abdominal distension, abdominal pain, sometimes with scour, and potentially as a sudden death. What we also see as a cause of sudden death sometimes in the PM room is a sort of a series of conditions that can lead on to each other, Albumasal, ulceration, rupture, and associated peritonitis. So pretty dramatic, horrible way to go if it does occur. Usually these conditions occur fairly young in life, but not exclusively with the Albumasal bloats. And the risk factors are not fully worked through, but some of the ones that are definitely on the table in terms of things that we need to consider would be a bacterial or microbial overgrowth with gas-producing organisms, and that could be a multitude of bacteria potentially, but also Sarsinia species as well. An excess of fermentable carbohydrates coming through into the abomasum, anything that will delay abomasal emptying, and systemic acidosis as well, possibly because of an excess production of acid further down in the GI tract. So those are certainly things that can predispose to abomasal bloats. One of the questions that we get asked a bit is it due to overfeeding of milk? And it would seem that the volume of milk that's fed is perhaps less of an issue, but its concentration is more of an issue. And I think once you get to concentrations of over 150 grams per litre of cart milk replacer, then that can potentially increase the risk of abomasal bloats, possibly by loading too much fermentable carbohydrate, et cetera, into the abomasum. Free access of water is important no matter what, but is helpful in preventing this condition, as is the hygiene of the milk feeding equipment or stomach tubes or anything that's putting milk into these calves. And certainly from some of the histopathology that's been done on cases through the PM room, the index of suspicion is on the fact that it's been bacteria that have been introduced through tubing or milk feeding in some way that have set up the abomasal bloat, and then what then follows from that. So hygiene, water, milk concentration, and reviewing the milk feeding practices overall in terms of how it's fed, what's fed, its temperature, the height from which it's fed. All these things can help in terms of reviewing abomasal bloats and reducing their risk if they are an issue. And these are some of the things that we will see at PM. You know, we've got a ruptured abomasal wall here with bleeding around about it, and there was an associated peritonitis here. This is an abomasal bloat at PM with an associated Albumasal in that case as well. So these are the things that we might see at PM and things to look out for. Nice, simple, gross pathology diagnoses that you can make without really needing to do much in the way of any further testing to follow them up. The other one's rumen drinking, and again, this is a particularly extreme example at PM, but it's always something to look for in any dairy calf post-mortem that you do on farm. If you're looking, is well, what degree of milk is in the rumen? It shouldn't be there. What degree of secondary fermentation has been going on, and what degree of rumenitis might be occurring as well, because all of these things come together and they can be pretty dramatic. And if milk feeding practices are good, esophageal groove function is good, then the milk should be in the abomasum and there should be little or none within the rumen at all. So rumen drinking is something that we see really commonly, which is just excess milk present in the rumen, and it starts to ferment. It creates an acidosis that then affects esophageal groove function, which means there's more likely to be milk ending up in the rumen, and the whole thing becomes this vicious circle. And we see it really commonly, and either as a sole cause of death or as a predisposer. And you can see in the picture on the right here, you've got the rumen wall of a calf that's been affected with evidence of a fungal, what was a fungal rumenitis that was occurring secondary to the feeding issues. So something to be aware of. You end up with nutritional scours potentially, and it can lead on to abomasal bloats as well. So definitely something to review, and then go back to reviewing milk feeding and milk feeding practices to try and avoid these issues if they're diagnosed. We've looked a little bit at what might be possible risk factors for rumen drinking, and certainly what seems to come to the fore would be drinking from a bucket rather than drinking from a teat, and drinking speed is the real one there, in that if once calves have learnt to drink milk from a bucket, they will hoover it up really, really quickly, whereas we will slow that drinking down if they drink from a teat. So drinking speed seems to be a real factor. Feeding waste milk, which shouldn't be done for so many reasons, is a factor, and sometimes that does creep back into dairy beef systems in that it's seen as a cheap source of milk to feed to calves in order to keep them going and then get them away at 2 to 3 weeks of age onto the rearer unit, and it will cause issues. And also feeding lower volumes of milk. So once you get down to sort of 2 litres of feed, that may well be a risk factor as well. And you know, we're not going to talk about milk feeding in huge detail tonight, but you know, we need to be feeding higher volumes than that per feed. So that's some of the nutritional issues. So maybe just coming on to some of the other disease issues that we see, I thought it was useful to think of, well, what do the dairy farmers get paid on if they're selling calves into a dairy beef rearer system? And a key one will be live weight gain. And what you can see on the right here is a sheet of calf sales. I've taken the prices of them, but that's a range of animals sold, different breeds, some of them purebred Holsteins, some of them British Blue Crosses, some of them Longhorn Crosses. We've got a date of birth, we've got a carcass grade, we've got a weight, and we've got a live weight gain, which this particular company will work out on the basis of an average calf weight at birth plus a weight at sale. So very often that's what farmers will be paid on, and they'll need to achieve a certain weight for age. They need to be clinically sound, no evidence of scour, pneumonia, navel swellings, herniation, etc. And they'll also get paid for a little bit on breed, sex, conformation, etc., etc. So those are the system that's in place at the moment, which are pretty functional. They work pretty well. One of the things to maybe think about in the future as vets is can we do better in future? And thinking about disease transfer and how we might better manage that, minimize the risks for both the host dairy farm and also the farm that is going to take them on as reared calves. And what we've got to think about with a lot of the calf diseases is a lot of them we will not manage to get rid of, in that wherever there are calves, there are going to be these diseases. So I'm thinking here about a lot of the respiratory pathogens, the Pasteurella, for example, a lot of the respiratory viruses, a lot of the scour pathogens. We're not going to be able to remove them from the calf rearing system, and therefore we've got to try and manage those through reducing exposure, increasing immunity of the calf. And to some degree that will be assessed by the current protocols that are in place with assessing daily live weight gain. But we've got to think as vets, can we do better with these systems in terms of pre-vaccination, either vaccinations of the dam with the rotacorona type vaccines, if we're going to looking at pre-vaccination of calves before they're moved for respiratory virus pathogens, and can we do more to assure colostrum status off the host dairy farm so that we can ensure that a calf that's moving on is a better bet. And you know, that's I think some of the challenges that are going to be there for the future, is to try and take what is a working system at the moment that works for selling calves and refining that to do risk-based trading and reduce the risks of spreading on disease. And then we can think a little bit about certain key diseases and could we take them out of the system completely. And the obvious one, of course, is BVD, and you know, basically ensuring that an animal is tag test negative before it is sold, which is in place in a lot of systems. Going forwards, could we think about taking animals from low-risk herds for Salmonella Dublin or low-risk herds for Mycoplasma bovis and moving them into a dedicated rearer unit? Could that improve health? There are options that are available for that, and that might be something there to think about in the future in terms of would that make a difference. It's an interesting challenge perhaps to think, and clearly if we can reduce the risk of some of these key infectious diseases, there's a win for the dairy farm and there's a win for the calf rearer as well. And I'm not really talking here about eradication necessarily, I'm talking about reducing risk. So moving on back to Katrina's survey and the key pneumonia diagnoses that we were getting from dairy calves, then the majority was bacterial, and one has to accept that we will be missing some initial viral infections, particularly at post-mortem diagnosis, but the majority of the diagnoses are bacterial that we get: Pasteurellacea, M. bovis, Salmonella Dublin, and we need to think, as always, of the whole complex as a pathogen soup. You know, bovine respiratory disease complex as a pathogen soup involving a diverse range of viruses and bacteria. I think no talk on this would be complete without some mention of Mycoplasma bovis as a risk, and particularly as a risk for chronic respiratory disease, both on the host dairy farm but also on a rearer unit, and how best one might manage that. Without doubt, it's part of the pneumonia complex. It can be acute, it can be chronic, and the chronic form of the disease with chronic coughing, mild fever, poor growth rates, relapses is a well-recognized feature of it. Pathology, the picture top right here just shows the sort of classic marbling that can occur in some of these chronic cases, and also a typical histopathological picture of a quasi-necrotic pneumonia, which in this case labels really nicely for Mycoplasma bovis. So the diagnosis is relatively straightforward, but I would always say, if you're seeing lungs like this, if you're opening up any calves on farm, it's always important to confirm that this is Mycoplasma bovis. Sometimes you can see chronic Pasteurella looking remarkably like this. Any chronic end-stage lung can look like this at gross PM. So it's important to be sure that M. bovis is involved in terms of then taking you forward to different treatment strategies, etc. The other one that's very often linked to M. bovis will be otitis media, middle ear disease, ear droops, head tilts, etc., which are increasingly recognized. And you can see a couple of PM pictures here on the right with microabscesses, and then this one here is middle ear disease as well. The interesting thing about this is that this picture here isn't actually Mycoplasma bovis, it's Mannheimia hemolytica, and it was just worthwhile putting that in. Again, a lot of the middle ear disease will be Mycoplasma bovis, but there will be other causes as well. It can be other things, and M. bovis is part of the mix with all of these disease presentations, but the Pasteurella can be part of it as well. This was just an interesting paper looking at Mycoplasma bovis infection dynamics and how it can spread within herds, and just looking at how it enters a herd and how it can spread from cows to calves, and how that then focuses on control factors, in that nearly 90% of infected herds to start off with had small numbers of index cases of mastitis, which were actually quite hard to pick up. And actually only a small proportion of those herds ever showed a positive bulk milk PCR. But it was interesting how quickly that infection then spread onto the calves, with initially nearly 90% of calves could subsequently, 90% of herds could subsequently isolate M. bovis from swabs from calves. And then over time, that percentage dropped. But it really shows very nicely how it spreads initially from the cattle, the dairy cattle, very quickly onto the calves, and it can then stay within the calf population for long periods of time. Don't want to fill tonight's talk entirely with Mycoplasma bovis, but I thought it was worthwhile mentioning a little bit about vaccination for M. bovis, which is certainly topical at the moment, and it really forms down two paths. Previously, we were reliant on autogenous vaccines to be created for Mycoplasma bovis, and there were variable reports in the literature of efficacy with these vaccines, some showing a good effect, some showing no effect, and some actually making it worse. And it didn't or wouldn't be expected to clear the disease completely. As a lot will know, it's possible to import a Mycoplasma vaccine from the US now as well, and that's being employed on some farms with good success. If you look at the product information for the vaccine, then it really sticks to one dose of vaccine for animals over 60 days old. And a lot of the studies, if you look at the data online, are in feedlot systems in America or Canada, where animals could be vaccinated on arrival onto the feedlot in conjunction with other respiratory vaccines, and it shows good effect in that they've got some good results from doing that. How you then translate that into a dairy calf situation and a young dairy calf situation is perhaps slightly more complicated, but there are protocols that are being devised around vaccinating the cows at dry off and then vaccinating calves thereafter. And although the evidence base behind that is probably fairly small and is based on experience, that there is some experience of that working reasonably well. On respiratory pathogens as well, it's worthwhile perhaps mentioning Histophyllus somni, which we do see on some dairy farms. I'd always historically thought of this one as a sort of beef finisher type of disease, and we saw it less on dairy farms. And I would say we're seeing this more on dairy farms in recent years, and then it does feed into the dairy beef systems from there as well. And got this slide from Alwyn Jones, one of my colleagues, and it does highlight some of the clinical presentations that have been seen with Histophyllus somni. And it isn't just pneumonia, it may be fairly non-specific and include pyrexias, neurological signs, gait abnormalities, and arthritis as well. And some of the pathological signs as well can be fairly subtle. So I think increasingly now we're always considering Histophyllus somni in the mix for possible pneumonia and possible also septicemia and polyarthritis, and I'll come on to that in a second, in dairy calves. And it's certainly something that we would always be looking for and considering, and would suggest in any workup that you do, it's always worthwhile bearing it in mind. We are seeing more of it in Scotland, and it is a potentially changing disease trend. And a few pointers on the diagnostics with it is that bacterial culture may not always be useful. We may not get this diagnosis from bacterial culture in every situation. Similarly, serology in, let's say, convalescent calves is not always useful either. Gross pathology can be really useful. We would say in this situation, histopathology is essential, and a lot of our diagnoses have been suspected or made on the basis of histopathology. And using PCR for H. somni has been a great way of actually confirming some of these suspicions based on histopathology. So definitely one of these ones where if you're getting sort of chronic problems, and I'll cite one of those in a second, in either dairy calf systems or dairy beef systems, and not getting to the bottom of it, is do give us a ring and we can try and give you the best advice on how best to perhaps try and get a diagnosis or rule in or rule out H. somni if it is there. But we'll need a combination of PCR and also histopathology to get to the bottom of it in quite a lot of cases. This brings us on to another interesting case presentation that we see in dairy beef systems, and I would describe it as septicemia, polyarthritis, meningitis, encephalitis. It can involve all of these different things in different combinations in different calves, and very often will present as either sudden deaths with neurological signs and potentially with polyarthritis as well. And we've seen this in a range of dairy beef systems over the years, and with it, we would always have as our differentials to consider, is this Salmonella Dublin could be a possibility. Is it Histophyllus somni? Is it Mycoplasma bovis? Or could it be another bacterial septicemia that's causing this? And one interesting example that we have seen is actually E. coli causing this on more than one holding. And normally, I think we would all associate E. coli as a cause of, meningitis, septicemia, polyarthritis in very young, 1 to 2 week old calves associated with failure of passive transfer. And in this, it was occurring in calves between 3 to 6 months old. So it was out with the accepted norm. Very often it was peracute disease, such that the clinical prognosis was pretty poor. It was hard to tease out any risk factors because on a dairy beef unit, all the calves are multi-sourced from a different range of sources. And these calves had done really well as young calves as well. So as milk-fed calves, they'd not had any major issues with disease, but had succumbed to this syndrome in post-weaning life, 3 to 6 months old. And I suspect it will come down on the farm to the balance between infectious challenge and a range of different immunities as they get older and as they lose their maternal immunity, and a range of different infectious disease challenges that might come along at those ages. But this whole general syndrome of polyarthritis, septicemia, polysericitis, meningitis, encephalitis is certainly something to consider as a cause of sudden death with a bacterial cause at the root of it. Salmonella Dublin is worthwhile mentioning because one of the signs that we will get, as we just highlighted with Salmonella Dublin infections, is a septicemia. The full range of presenting clinical signs are listed there. And we will see these septicemic calves with Salmonella Dublin with, on occasions, jaundice, like the picture top right, large spleens, and sometimes we'll see the end stage effects of this with calves that have had a vascular injury with either ear tip necrosis or lower limb necrosis. So we will see the full range of Salmonella Dublin clinical presentations, both on dairy farms and in dairy beef systems. And again, it's worthwhile pointing this one out, that the range of clinical signs with Salmonella Dublin can be quite variable. Diarrhea is the most common, but even so, only 56% of calves and 73% of adult cattle with Salmonella presented with actual diarrhea. Respiratory signs and pneumonia is a not uncommon presenting clinical sign in dairy calves. So 20% of them will present with pneumonia, and then other numbers will present with ill thrift, wasting, for example. So again, Salmonella Dublin in these systems is always something that we need to bear in mind as a cause of either pneumonia, of sudden death, scour, and possibly this septicemia syndrome as well. We don't know how common Salmonella Dublin is on our ERA units, but we suspect it's probably fairly high because it's a fairly common disease in our dairy farms and it will feed through. In Denmark, they have done active surveillance on their dairy beef rearers, and in Denmark, 40%, just short of 40% of their rearers were positive. And I find that quite interesting because Denmark is a country where their Salmonella Dublin prevalence will be much lower than it is in Great Britain. Just mentioning Denmark, and again, thinking of future control strategies, in Denmark, they actually have, I'm not going to go into all of the detail of this, but they have a national control program for Salmonella, which will stratify herds as level 1, which will be low risk based on bulk milk testing, level 2 that don't meet these criteria but have had no obvious clinical cases of Salmonella, and then level 3 where they have clinical diagnosed salmonellosis in their herds. And in the Danish system, then they restrict movements from level 2 and level 3 herds. And again, I was alluding to this earlier on, I don't think in Great Britain we're ever going to get to the level of doing this, or at least not anytime soon, given the amount of vaccine that's used. But it is an option to consider risk-based trading for certain dairy herds, and then their calves going into dairy rear systems. Is could we identify dairy herds which were lower risk for Salmonella Dublin, and then that being an option for future control. Okay, we're getting to the end of the talk, you'll be pleased to know. And I just wanted to focus a few more general topics, moving away from specific disease agents and talking more generally about pneumonia and growth rates and what calf rearers are looking for. And I think always one of the interesting questions with any dairy heifer rearing system or dairy beef rearing system is our ability to diagnose pneumonia and diagnose pneumonia quickly. And I've told this story many times, but very often we'll get calves in for post-mortem with really dramatic lung damage, like these two pictures here. And when you talk to the farmer who's dropped it off, who will be a good stock person, and you'll ask them the questions of, how long's it been ill for, and they'll see some of these cases as acute, in that they'll see that it was off its milk the day before, and then the next day it's dead. So in their view, it's an acute disease process. And when you look at the pathology, it tells you something completely different, in that it's a much more long-standing disease process. And unfortunately, the calf will be right. And it just shows you that actually young milk-fed dairy calves, sometimes they do not exhibit the classical signs of pneumonia that readily, and it can be quite hard to detect. So we want to obviously pick these up as early as possible. We want to be picking up very subtle cases of pneumonia if possible, and managing them as effectively as possible. And certainly the advent of thoracic ultrasound has been an interesting tool to highlight the degrees of lung damage that might be occurring or not occurring in calves' lungs, and highlighting early stage disease and the ability of us to pick it up as vets and stock people, because it's difficult. It is difficult sometimes to detect pneumonia in these calves early enough. And that leads on to an interesting discussion about what is an acceptable treatment rate for pneumonia. And you can pick a percentage wherever you want. And I think my main comment was you don't want it to be too high, obviously. But similarly, you probably don't want it to be too low either, because I would always worry if we've genuinely got a treatment rate for pneumonia of less than 10%, are we missing something in a dairy heifer rearing system or a dairy beef rearing system? And perhaps somewhere realistic in the middle is around about the 30% mark, and if treatment rates are below that, then that's maybe a good way to go. That's a debate that could run and run, and clearly you need to set targets that are specific to an individual farm. But there is always going to be this balance between sensitivity and specificity. If we're not sensitive enough in our pneumonia detection, then we're going to miss too many cases. We're going to have delayed treatments, we're going to have reduced cure rates, we're going to have compromised welfare, and then we're going to have increased risk of disease spread either onto other calves in the group or other calves on a rearer unit, and that's going to affect growth rates. And there's lots of work that's been done. I've cited one example here where Alex Bach, greater than 4 episodes of respiratory disease and a significantly reduced chance of getting to the end of first lactation and finishing first lactation. Obviously, if we think about pneumonia detection as a diagnostic test, if we're not specific enough, then we'll have too many false positives. We'll be treating too many calves that are actually healthy, and we'll be using too much in the way of antibiotics. So there is this sweet spot, like all of these things in the middle, where we need to be trying to treat the calves that need it in the most appropriate way, without treating too many calves and using too much in the way of antibiotics. And that is the challenge for us all. And there are detection systems that are available, and what we're thinking about increasingly in some of the work that's been done research-wise at SRUC is looking at proxies for clinical exam. And a lot of work has been done using the Wisconsin scoring systems. And you can see in these graphs on the right here, basically, we're splitting calves into healthy ones at the top, where their Wisconsin score is below 3, intermediate calves in the middle, where their Wisconsin score is rising a little bit, and the cumulative score is greater than or equal to 4, and then these ones on the bottom, where we've got a clinical disease episode, where you can see their scores rising above this threshold of 4 for a period of time, rising and then falling. And then you've got a chronic disease calf here, where it's consistently bumping along well above with a high score. And the scoring system is just as many of you will have used it, it's a clinical examination with a score attached, looking at your nasal discharge, ocular discharge, ear droop, coughing, temperature, fecal score, etc., etc. And although it's very labor intensive, it can be a great way of showing and demonstrating, how good we are at picking up disease, and whether we're good at picking up early, which is going to be key to the whole process. And some of the work that we've been doing is looking, rather than at Wisconsin scoring, is looking at proxies for it, is what measurements can we use, and perhaps what measurements can we use and automate that will pick up and show early disease earlier, and be able to identify it well, get it treated specifically, and target the treatments where they're really needed. And there's some promise coming with this. Firstly, with the use of temperature and an ear tag that can be used to detect a spike in temperature early. Subtle decreases in milk intake. You can see the calf guide graph here showing where the milk intake should be and how it will fall below that at certain periods of time. And really, even the most subtle reductions in milk intake of 1/2 to 1 litre can be a good indicator of issues if we can measure that. And then, although not available at the moment, but hopefully will be in the future, is activity meters for calves. And again, there's been clear demonstration that calves will show perhaps reduced activity in the 2 to 3 days before they present with clinical illness. But this is interesting work. There's a lot more that's being done on it. It's not yet completely refined, and also some of the studies are showing slightly contradictory results as well. So there's more work needing to be done to refine this, to get good tools that can be used in practice to identify problems as they occur. This is all going to feed in again from the medicines use. Then there are key metrics for calf rearing enterprises that are now coming to the fore, and again the latest round of RUMA targets that came out last year, milligrams of antibiotic used per kilogram live weight, using a standardized weight for calf and an average number of livestock on the unit is going to be the measure that's going to be used going forward. Also, interestingly, looking at the proportion of animals undergoing antibiotic treatment, and then also looking at the mortality rate as well. So there's going to be certain measures that are going to be used going forward by RUMA and will be more and more incorporated into the standards to look at antibiotic use in calves. So this detection, both in terms of sensitivity and specificity, is going to become increasingly important. But just to round off, if we go back to, well, what are farmers getting paid for? And weight for age is a big one, and we have to think about growth rates, and we have to think about, well, how good are we within our dairy systems at the moment? And this is a paper from, I think, probably 4 or 5 years ago now, from southwest of England, looking at growth rates in dairy heifers, so not beef cross, but dairy heifers, and they basically looked at the upper quartile of herds, the middle quartile of herds, and the lower quartile of herds, and looked at growth rates at different age ranges, so 30 days, 30 to 60, and then a more of a lifetime growth rate lower down. And I find these quite interesting and quite scary, and a bit of a wake-up call. So if we're thinking about a target growth rate of 0.75 kilos per day, and certainly more can be achieved if we rear calves well and feed them well, then the sort of growth rates that we're talking about here are falling short of that. You know, if we're talking about 0.5, 0.6, we're talking about 0.2, 3, 0.4, but there's quite a lot of challenges here that we need to think about in terms of overall growth rates and how that works, and how we can improve on those. And as vets, we've got a huge part to play in trying to measure this and maximize this, because this is ultimately what's going to drive dairy heifer health and production, and it's also going to drive what the beef rearer needs as well. And disease is a massive part of it. And that's why a lot of this talk has focused a lot on that. And just in some very simple farm-based data that we lifted, and we looked at pneumonic calves versus healthy calves. And I say this was based on farmer recording. So it was farmer detected cases and farmer treated cases. Then the pneumonic calves, if there were severe cases of pneumonia, grew at 0.2 kilos per day and were 14 kilos lighter at weaning. So pneumonia in its more severe form can have a dramatic feature on growth rates. The graph on the right is a more subtle look at it, in that this was calves that were assessed by Wisconsin score. So there was regular daily Wisconsin scoring being done, and the healthiest calves within the group were here on the left rather, growing at up to a kilo a day, and then the sickest calves in the group, based on Wisconsin score, were growing at a lower rate with a much wider age range within the group as well. So whichever way you look at it, health has a big impact. And the other one, and it's interesting to put this slide in on a beautiful July summer day, is temperature and environmental temperature. And this is some work that David Bell did as part of his PhD at Crichton, which he finished last year. And it shows the proportion of time that calves spent below their lower critical temperature in the first week of life in different months of the year. So you can see during the winter months, so if we go for the middle here, March, February, January, December, November, then a massive proportion of their time is spent below the lower critical temperature. And even in some of the summer months, then a small amount of time in the middle of the night would be spent below lower critical temperature. So the key messages, particularly in the first week of life, certainly for calves up in Scotland, is that environmental temperature will drive a significant amount of how calves will perform in terms of growth rate, how much energy they have to spend keeping warm, which they could ultimately be using to either fend off disease or grow more efficiently and quickly. So I think that's just about me got to the end of my talk. Yes, it has. So hopefully what I've given you is a bit of a mixed bag, really, I suppose, a real overview of where the industry is, what the challenges are to vets, where it might go in the future, and hopefully scattered in amongst that some of the disease challenges that we see, some of the options for managing them, and hopefully there is something there that you can take away and think about if you're either working with the dairy farms that might be supplying these rearer contracts or rearers that might be dealing with them as well. Okay, thanks very much for your time. And if there's any questions, I'm happy to take them, or you can always get in touch and we'll try and answer them.
That's just absolutely fantastic. Thank you so much, Colin. Really fascinating and so many useful points to go away and reflect on. So if any of you do have questions you'd like to ask, you can pop them into the questions pane or the chat pane on the dashboard that you have. We do have one question already, Colin, which I'll put to you, which is quite an interesting point, I think, just to reflect on, was one on measuring passive transfer and the herd level monitoring. So looking at the fact that traditional cut-off points were based around minimising mortality. And data from the US you might be familiar with from Lombard and Godden, suggesting a different approach, looking at minimising mortality and morbidity in calves, so aiming to achieve 40% of calves in the excellent category. So it's just an interesting point, I think, on shifting our targets to try and help us live with diseases that are unavoidable.
Yeah, I think that's a really excellent point, and I think it also, we want to be maximizing this as much as possible, really. I think that's the key point is that, yeah, a lot of these thresholds are set around the minimum of what we want, whereas actually, we want to be maximizing passive transfer as much as is absolutely possible, and that is where we'll get the win. And also, there will be a variation in disease challenge. I said that as part of the talk. There will be a variation in disease challenge to calves in terms of what's going to hit them, and that will become increasingly unpredictable if they move into a rearer system. And that is the big unpredictability of that system. You can't fully control what diseases they're going to meet, so therefore maximum immunity is what we need to be striving for, and a lot of the subtleties about how we manage colostrum and feed it is going to be really critical to that.
Yeah, absolutely. So I'm just giving everyone a chance in case there are any other questions to add in here. Please don't be shy. We won't name and shame you, but it's always nice if people would like to pick our brains. And as you'll all be aware, obviously, if you're anything like me, you come away from a webinar and about half an hour after it ends, you come up with a question and you wish you'd asked it at the time. You can obviously always get in touch with us. You can contact us through our website or phone your local centre, and we can certainly put you in touch with Colin. And always happy to help. So, but I think that may be us covered. Thanks to a very, very comprehensive presentation, Colin. Oh, we've got one more come in. Yeah, a question here from someone who missed the first bit of the webinar. So we did touch on this, but looking at the limit in age, beyond which we wouldn't use a stomach tube for giving milk. If they're not taking milk themselves. So in an unwell animal, Colin, what sort of age would you say it's appropriate to use a stomach tube?
Yeah, it's a really tricky one, that, because if it genuinely will not suck, then your options are limited. But there is this vicious circle that's set up in terms of the more you keep going with the stomach tube, the more that you keep going with the risk of rumen drinking, acid production, and sort of setting that whole snowball running down the hill, if you see what I'm saying, the worse it does get. And therefore it is really a question of persevering, and it's such a hard thing to do, and it's such an easy thing for someone like me or any vet to say, because it's not us that ultimately have to do it, is persevering with teat feeding and just trying to stimulate that going forward, because that is ultimately the way to try and break the cycle. But I do worry a little bit that we might be setting some of this up right from the start, and it's one that's perhaps easier to correct from the start if it's possible, in that a lot of the problems probably do start when you have a calf that is born with a slightly slow calving and is therefore slightly acidotic right from the get-go. And I think we're all very good at recognizing the really acidotic calf that's had an obvious difficult calving and it's coming out yellow, or it's been a vet calving, and we can treat that with bicarb to try and get that going right from the start. But there will also be cows that calve themselves, calves that are born themselves, which have a prolonged calving where the calf is slightly compromised when it comes out, and therefore is born slightly acidotic, which means that you were almost setting it up for an abomasal, a rumen drinking issue, an esophageal groove issue right from the start potentially, or at least we're risking that starting early on in life, and then things can run from there. So I think if anywhere, the focus is on really looking at calf figure once it's born, and trying to manage that as best that we can. And a lot of it does come down on that ease of calving and managing that, assessing calf figure, and dealing with it as early and possible in life as we can. It's not a very satisfactory answer to that, I know, because it's a very difficult problem. So I'm not claiming to have got all the answers to that one.
I think we so often find ourselves coming back around to that, don't we? And I guess that's the challenge if someone's rearing these calves, is they're not always in control of those factors to the degree we like. So great. Okay, well, I think that wraps us up for tonight. But yep, just to reiterate, if there are any other queries or questions, you're always very welcome to pick up the phone or drop us an email. We're always happy to hear from you and help. Which just leaves me to thank Colin very much for your time tonight. Colin, much appreciated, and thank you all for coming along to join us. We hope you've enjoyed it and found it useful, and we'll see you again at the next one. Thank you.
Thank you. Cheers now.